I'm just going to now outline the 5 steps to going live with Scribe, because one of the commonest queries we get is how do I start the process? And essentially, there is a governance process to go through, which we're going to outline for you today. So there are 5 steps. The 5 steps are as follows. We're going to review the DPA, DPIA. I'll talk about the acronyms as well. Step 2 is looking at the clinical safety, the technical term for which is the DCB 0160, which you've probably heard quite a bit of. And step 3 is looking at patient communications. And then step 4 is to implement and start using the tool. And then step 5 is the post-deployment review. So they are our 5 steps to going live with Scribe. So let's go through each of these in turn. And again, as Satya said, just pop in your questions into the Q&A box and we can certainly pick these up towards the end. So what is step 1? Step 1 is to review the DPA and the DPIA. Now, the DPA is the data processing agreement. So it's an agreement between the GP practice, who are the controller, and Accurx, who run the Scribe with Tandem, who are the processor. So whenever you roll out a tool, you are signing an agreement between the controller and the processor, and that's what this agreement is. So certainly review that. And essentially, as the controller, you are the decision maker. And what you need to do is ensure that the processor is trustworthy. And then you sign the DPA, which outlines what data you're going to be processing. And then from the processing end, they follow the instructions in that agreement and follow the controller's instructions. And they are there to really keep that data secure within that agreement. So the kind of things that may go into the Scribe processing agreement are things like the audio recording, which isn't retained and no data stored on user devices. So things like that are examples of what goes into a data processing agreement. Alongside that, there's the DPIA, which is slightly different. This is the Data Protection Impact Assessment. It's a really great tool, and it's a legislated document. It's required under GDPR and the NHS obligations. And in effect, it's a risk assessment process. So it's a process to really do a risk assessment of the tool itself. And what we really try to encourage is actually, can you do this at scale? So we certainly know in some areas this is done alongside the ICB, and the DPO, the Data Protection Officer within the ICB, can certainly support to roll this out at scale so that you're not having to do all the heavy lifting yourself at your practice. Where else can you get support? Because a lot of the time, the actual assessment is very similar across a ICB region and also nationally to a certain extent. And what this really does, it ensures the safety and the privacy of patient data. So it looks at what's happening to the data, and it's effectively, it's an impact assessment on the data. And ultimately what we're looking to do, we're looking to prevent harm and improve care delivery by ensuring that data is protected properly. So this is a key document. And what we've done here at Accurx is that we've provided a template so that actually if you're looking at doing this yourselves or want to review it yourselves, absolutely have a look at the template document, and then you can certainly amend that to localize it for yourself and also maybe something you want to discuss with your ICB. So that's step 1. Step 2 is clinical safety, and the technical term for this is the DCB 0160. And again, the clinical safety side of things is a really important part of the process to start using and implementing the Accurx Scribe tool. What this really ensures, it ensures that the tool is clinically safe, you're preventing harm, and it produces a formal safety checklist in the form of a hazard log that you can review. And ultimately, this will improve the care that you're delivering as well. So essentially, the clinical safety just enshrines these principles. Now, the key thing early on is for practices to get on top of the compliance. And this is really to look at how do you complete the DCB 0160. Now, there's various ways that this can be approached. We've set out a way that we feel may well be very supportive of practices. One of the key things to do is to understand what it is that you're looking to implement. What is the product? The best way to do that is to watch the demo of it and also potentially test it in a non-clinical environment. There are quite a few links and resources. If you go on to the Accurx resources pages, you'll be able to find demos to the Scribe. And also as a follow-up to this webinar, we'll be sending out some links to this as well. So certainly have a look to see actually what is it, what can it do? Then you need to look at appointing or working with a clinical safety officer. Now, this is done in various ways, and Asad is going to talk about an approach that he's done in his area later on. But essentially, your practice will need to appoint a CSO or have a CSO in-house. And I'll also come to some resources that Accurx are developing to help support practices in upskilling themselves in having a clinical safety officer in their own practice. So this is something that, again, I think will be really valuable to practices going forward. It's something that we'll be leading quite heavily onto. So it's good to think early about actually who is our clinical safety officer, as well as our DPO, which historically we've been more in tune with. Once we've done that, then it's important that we review the Accurx clinical safety case report. Now, whenever you do a clinical safety case, you're not doing it from scratch. You're using the clinical safety case report from Accurx. So Accurx have produced a clinical safety case report on the Accurx Tandem Scribe. And what you would then do is review what is it that has come up in the report that you may want to lean into when you produce your own report. So there's already quite a lot of information out there that you can review. Alongside the case report, you're reviewing a hazard log. So what are the potential hazards that have already been identified, or things that you need to be aware of before using the tool itself? So you review both of those documents, and then you put together your own clinical safety documentation. So effectively, you produce your own set of documents, which are called a DCB 0160. And here, what you would document is any transferred risks or any mitigations that you feel actually you need to be doing when you implement a tool. It sounds a bit daunting, but actually once you start the process, it does become quite easy to look at and to go through. And just to highlight that the Accurx clinical team are on hand to support, and there's some great resources that are being provided by the clinical team here to help you on the journey to become clinically safe and to implement the Scribe in a safe way. And again, alongside the DPIA, we've got a template for the DCB 0160. So again, you can go through the template, localize it for yourself, and really look to implement this in a safe way that you can be confident of going forward within your practice. Now, I talked about some resources we've got in-house. There are a couple of resources I just want to highlight at this point. The first one is CSO training. So Accurx are providing CSO training, so clinical safety officer training for practice staff. And if you would like to sign up for that, or send somebody from your practice who's a clinician to become a clinical safety officer, here's some details on that, and I'll share this towards the end as well. But we've got an in-person event here at Accurx headquarters in London on Monday, the 17th of November, if you wish to attend. There's also a follow-up one that we're considering to roll out, which will be remote as well. But this is one that's coming up. So if you're interested, have a scan of that. The other resource that we're rolling out is, we know lots of practices out there have got queries that they just want to ask, and often don't know who to ask first. So we've set up a clinical governance drop-in where you can just book 15 minutes with one of our team here, and you can basically ask any questions or review any particular queries you have that you are worried about, or you just want clarification on before you go live with Accurx Scribe. So again, giving you that confidence to be compliant, secure, and really personalize the clinical safety to yourselves. So certainly have a look at those resources as well. So when you go through the clinical safety case, just to go through what are the things you're looking at, essentially you're looking at what are the potential hazards and what can you do about them. So as an example, I've just got a couple of examples here that you might want to consider. So for example, a hazard could be that the generated notes may contain incorrect information. What could the cause of that be? The cause could be transcription error, or it could be a hallucination by the AI tool. So these are causes that could cause that hazard. So as a practice, we then need to think about actually what are the controls, what are the mitigations that we need to put against that risk and that hazard. So we look at things like, actually, do we need to test the microphone to make sure it's an appropriate way that we're picking up the sound? Is it something that we need to implement in terms of the clinician who's saving the record just needs to review it before saving, just to make sure that it is correct? And do we need to put some other safety barriers up? So any issues that might come up about generated notes that may contain incorrect information, so we should be discussing this in our clinical meetings just to see what other people are experiencing as well. So you can see here, we've got a hazard, we've got a cause, and we've got a risk control and mitigations in there as well. And that's essentially what you're doing when you're going through a clinical safety review of the hazard log, which forms the bulk of the discussion. Another example could be, let's say there's a hazard that the patient summary may be saved in the wrong patient records, and it's something that can potentially happen. So let's have a look at what the causes are. So we do a bit of a brainstorm and think, actually, this could be a potential hazard, but what could be the cause? The cause could be that actually the clinician is opening up another patient's record when they're starting a scribe on another patient. And so therefore that's a risk. We would document that, put that in the hazard log, and then we look at how do we control that risk. So the control of that would be to actually, let's educate everyone, actually you don't move to another patient when you're starting a scribe, stay within that patient record. And we should be looking at whether there's a confirmation of the patient that we're saving to before it's actually saved. And some of the mitigation is at the Accurx end. So what we've done is that we've also looked at this potential hazard and said we're going to build in a safety mechanism whereby you have to confirm that the patient you're saving to is the patient that you're transcribing from. So again, it's that risk control that we're looking to mitigate. And then the other mitigation could be that the clinician has to check the record once it's been saved. So again, having a look at various hazards, looking at the potential causes, and then putting in the risk controls. And this is really what we're looking to do with the clinical safety case review. And it's a really great way of really implementing a tool with confidence. And that's what we really want clinicians to do, to really use the tools that are out there and to really be confident in the use of them and to really benefit ourselves as well as the care that we deliver to our patients. So step three is all about communication to patients. Now, there are several things that we need to look at communicating with the patient. Most DPIAs specify that the practices who have a document called a privacy notice needs to be updated. And often this needs to be discussed with your DPO. So depending on what your privacy notice currently states, your DPO, your data protection officer, may want to update it, and you just need to discuss that with them, and just to make sure that has enough information for your patients on that particular privacy notice. The other bit of information that you can declare to your patients is through posters or on your website. So look at actually what information can you give to your patients about what are you doing in your practice, what is Scribe, or what it's aiming to do. And for that, there's, again, loads of resources out there. And again, if you look on the Accurx resources, you'll be able to find some posters and some FAQs that your patients can certainly benefit from. So again, look at those resources. There's a QR code there for you to pick up. And what we've done, certainly in our practice, is pop them up in the consulting room. So if people have got questions, and also in the waiting room, as well as on the website. So there's various ways that you can actually inform your patients so that they're aware that things are happening, and you're doing things differently for the benefit of care altogether. The other bit of communication is at the point of consultation. So there's lots of transparency that goes on with the patient. So before we're using a AI scribe, just to inform the patient. So my usual message to the patient is that I'm using a AI scribe to help me write up my notes. Are you happy for me to use that? And patients invariably will just agree to that, and then you can continue with the consultation as you would normally. The occasional patient who says that they're not happy, or they've got concerns, you can stop the recording or not start it in the first place. So just having that transparency is really, really important with the patients. And again, it just builds confidence, and it strengthens that doctor-patient relationship that, look, I'm delivering really good care for you, and I really care about the notes that I'm writing up to be of a really great quality. So that's patient communication step 3. Step 4 is actually, once you've done that, then we can go forward and look to implement and start using Scribe. To do that, we really need to ensure that our staff are trained well, and a lot of healthcare organizations really feel that actually there's a few people that are aware of how to use a tool, but the rest of the organization isn't. So it's really about how do we distill all the information down to all of our staff so that they all feel confident and safe in the fact that there's a tool that's being used that can help with patient care. And again, just to emphasize the accountability and governance structures that actually need to be enforced. So the DPIA has been signed, the DPIA has been done, we've done a clinical safety document, we are confident of using this tool within the practice, and then just to share that around. And the ways that practices often do this is just to get people to just generally stay in the loop, to ensure that actually when you're doing a consultation, just make sure that you're checking the notes before you're acting upon them, and ensure that actually AI is a great tool. It saves time and saves a lot of cognitive load, but it isn't 100%. And so therefore just being aware of that when you are consulting, and then just use it responsibly, use it within the practice accordingly, and just to do it alongside the governance that your practice has for general data governance overall, and to regularly discuss this in clinical meetings. So one of the key things with implementation is just to take the practice on that journey. And what we've done is that in our practice, certainly we've just put as one of our mitigations is that we've got a standing item called use of AI Scribe, and we just basically talk about actually what have you done in terms of the Scribe this week, and have there been any specific issues that you want to discuss? Do we need to review the hazard log, for example? So there are regular discussions that are happening, and this kind of then overlaps into step 5, which is post-deployment review. So once you've implemented, you'll be reviewing this on a regular basis, ongoing, and certainly regular meetings is a good way. So most practices are saying we're going to implement this as a standing item into our weekly clinical meetings, for example, but having that regular review within your clinicians is a really good way of ensuring that you adhere to your clinical safety guidance. And then update the hazard log periodically. So if you find actually, having used the tool, there are some other things that we hadn't thought of, let's update that hazard log and keep that up to date, and then share that with the staff so everyone's aware of what are the hazards that you might be bringing up. And again, with all of this, it's a feedback loop. So if you've got any specific concerns or hazards that you think, actually, I've noticed this when I've been reviewing and doing my own hazard log update, maybe I should share this back, and absolutely share it back with the team here. And what we can do is just look to implement better resources and ways that we can support other practices along the way.